The single most common sentence I hear from patients after a hip or a knee replacement is a question: why didn't I do this earlier? That tells you almost everything about how this decision usually plays out. Not too fast, almost always too slow. Here's what I want you to hear first. Surgery should be the last resort, not the first move. There are good non-surgical treatments for the symptoms of arthritis. Most people get years of good living out of them before surgery ever belongs on the table, so to speak. So the question isn't whether you're tough enough to keep waiting, it's whether the waiting is still working for you. Now, let me tell you what does not tell you it's time. It's not a specific x-ray finding. It's not a magic pain number. It's not your age. Yes, your x-ray matters and your pain matters, but the x-ray doesn't decide who rules the day. You do. Your symptoms do. Here's the honest way I frame it with my patients. Hip and knee replacement is a quality of life decision. So ask yourself one question. If your pain and the limits you have were taken away tomorrow, how much would your life actually change? If the answer is not much, then you're not ready. If the answer is everything would change, well, you're getting close. I look for three things in clinic. One, you've honestly used the non-surgical ladder. Movement, strengthening, weight management, the right anti-inflammatories that's safe for you, and maybe an injection. You've done all that work and you're still stuck. Number two, your life has quietly gotten smaller than it should be. You're turning down the walk, the trip, the grandkid visit, the round of golf, not because you don't want to, but because your joint simply won't let it happen. Three, you have a plan for the recovery window. This one is important. A ride home, someone nearby for the first few days. Recovery is a real part of this process. A little bit of planning makes everything a lot easier here. Now, here's the part patients rarely get told. Wait until it's really bad is really bad advice. There's no medal for suffering longer. There's no threshold you're supposed to hit before you're allowed to fix the problem. And you do not want to walk into surgery so beaten down that recovery starts at 0 or maybe -10. The stronger you are coming in, the better you'll do. Same principle that we're talking about with the knee applies to the hip. The signal isn't a specific test. It's a life that keeps shrinking. Patients ask me all the time how they'll know. Here's the honest answer. You'll know. It's not a lightning bolt. It's the moment you realize you've been arranging your whole day around the pain. You've quit doing the things you used to love. You're tired of hurting, and the treatments you counted on just aren't holding on anymore. When it all lines up that way, you'll know. And one more thing, you will not miss the window. This surgery works whether you do it this year or next, so you don't have to rush in. But also, don't wait so long that you lose years you were supposed to be living fully. Ask yourself the quality of life question honestly. If it's time, come in. Let's talk through it. There's a link below. Drop your questions below. They inform future videos. I hope to find you right back here. Thanks for watching.